Good day everyone, I am Joanna Duran from BS1 Section 11N from Davao Doctors College, and today I will be performing a return demonstration of cardiovascular system assessment. So the cardiovascular system is a system of your body that supplies oxygen, nutrients which are needed to our daily activities. So doing a cardiovascular system assessment will help us identify factors that could affect our cardiovascular health, such as high blood, cholesterol, hypertension, diabetes, and some other stuff, both common and uncommon. So for the pre-inductory phase, prior to performing the procedure, review the client's medical record as needed and check the doctor's order for the need to perform the assessment and determine the scope of the assessment and needed, prepare necessary equipment, perform hand hygiene, and since I already washed my hand, and then so now I'm going to prepare the equipment. For this assessment, we'll be needing a rectangular card here, and then a ruler, 8-inch ruler, and then a our jugular venous pressure. Next is our pen light. Here, and then our stethoscope for palpating the heart. And then, so prior to conducting the assessment, rest assured that I already perform a hand washing and clean and sanitize myself before meeting the client to prevent cross-contamination. So now we are going to greet the client politely and the client's companion if around, and introduce ourselves and verify the client's identity. Also, the client would like to be called during the assessment to establish rapport with the client. So, good day, sir. I am Joanna Duran from your student nurse for today. May I see your name, sir? And please state your full name. What is your birthday? Your age? Okay, thank you. And then now we are going to explain to the client the procedure and how he participate during the assessment, provide the client the opportunity to verify and or clarify, ask or raise any concern, and ensure the client's comfort, privacy, and confidentiality. Drape the client body as needed and throughout the assessment, and also inquire if the client has any wrestling and history of cardiovascular problem, as well as lifestyle habits and that are risk factors of the cardiac problem. Okay, so good day, sir. I am your student nurse. Okay, so sir, I want to know if you have any heart problem or relatives that have any heart problem. Okay, so okay, sir, all the information that we'll gather during the assessment will remain confidential between me and you and your assigned physician and your attending. I'm your nurse, and ikaw po then client, rest assured po okay. So do you have any questions, sir, before we proceed the assessment? Okay. Okay, so I already closed the curtain and para to provide client's privacy. Now let us start the assessment of jugular veins. Inspection of those vessels can provide information about the blood volume and pressure in the side of the plane of the heart. And stand at the right side of the client and position the client supine with the head of the bed elevated between Now let us start the assessment of jugular veins. Inspection of These vessels can provide the information about the blood volume and pressure in the side of the plate of the heart, and stand at the right side of the client and position the client's pain with the head of the head elevated between 30 to 45 degrees, making sure that the torso are on the same plane, and instruct the client to turn the head slightly to the left and above complete. Okay, instruct the client to turn the head slightly to the left and show tangential light source onto the neck and suprasternal notch, an area around the clavicles to observe from pulsations and shadows. Okay. And then, if jugular distension was noted, assess the jugular venous pressure by locating the highest visible point of the distension of the internal jugular vein. Emphasize the distension with tangential light, and deem necessary raise or lower the head of the bed to 30 to 45 and 60 and 90 degrees until the highest visible point of distension of the internal jugular vein was observed. Note the jugular vein should not be distension, bulging or protruding as a 45 degrees or greater. If so, it may indicate a right side heart failure. And then measure the vertical distance in centimeters above the sternal angle by extending a long rectangular object or card horizontally from the point and the centimeter ruler vertically from the sternal angle, making an exact right angle. Mayroon the other side. Okay. And then, with head of the bed still slightly elevated at 30 degrees, position the client's head slightly towards the side being examined. Palpate the carotid artery, cautiously avoiding too much pressure or massaging the area. Palpating very slightly to avoid blocking circulation or triggering vagal stimulation and bradycardia, hypertension, or own cardiac arrest. And then palpate the carotid arteries individually because bilateral of the carotid anterior may result to a reduced cerebral blood flow. Repeat the preceding step on the other side. Okay. Turn the client's head slightly away from the side being examined. Place the bell of the stethoscope over the carotid artery and ask the client to hold her breath for a moment and auscultate the carotid. Turn the client's head slightly away from the side being examined. Place the bell of the stethoscope over the carotid artery. Ask the client to hold his breath for a moment and auscultate the carotid artery, listening for broad and breath is blowing a swishing or swishing sound that caused by turbulent blood flow through a narrowed vessel, which is an inductive of occlusive arterial disease. If a breath was heard gently, palpate the artery to determine the presence of a trill. Repeat the preceding step on the other side. The other side. Okay. And then begin the general section of the chest wall. In woman, keep the right chest draped, gently lift the breast with the left hand, or ask the woman to do the for assistance, and stood at the right side. Simultaneously inspect the pericardium for pulsations while palpating the aortic area, pulmonary area, tricipit area, and apical area. First, we are going to palpate the hips and lips using the palm and hold finger pads flat obliquely against the chest, and okay. And then next, press the ball of the hand firmly against the chest with wall and feel for trills. So trills as a buzzing of or vibration sensation felt on the side caused by underlying turbulent flow, which indicates murmur caused by a incomplete heart valve. Okay. And then palpate impulses using finger pads flatly or obliquely on the body surface from the aortic area, pulmonary area, and area. And then we are going to palpate also using the finger to confirm the characteristic of the impulse. Using the 3 fingers, I'm gonna palpate. Now, using the diaphragm of the stethoscope, first then the valves auscultate the heart in all 4 anatomic sites which are the aortic, pulmonic, and tricuspid, and apical are for heart sounds, extra heart sounds, and murmur, and then ask the client to breathe regularly while auscultating. So first, I'm going to listen for his aortic area, which is located at the right sternal border in the second intercostal space. And then now moving to the pulmonary area, which is located at the left sternal border, second intercostal space. Okay. Now for the tricuspid, which is found at the left sternal border, fourth intercostal space, uh, and for the area which is located at the fifth intercostal space, clavicular. And then repeat the steps while the patient is in left lateral position, then in a sitting position, leaning forward, and briefly stop breathing after exhalation. Inhale. Exhale. Okay. And now examining upper extremities. Repeat the rest. Next, we are going to assess each arm for size, symmetry, skin color, and temperature from fingertips to shoulder, noted for any presence of edema and lesions, change in skin texture and hair distribution. Inspect the peripheral veins in the arms for presence and or appearance or superficial veins when limbs are dependent and when limbs are extended. Okay, as temperature is warm, skin color is consistent, no venous pattern, and no lesions or any signs of edema, and nail bed are pinkish and no changing on nails. And then palpate the radial pulse. So your pulse are bilaterally strong and normal. And now, assess for the capillary fill. And now, assessing your capillary fill to check for the blood flow through peripheral tissues. So capillary fill is good. So perform the Allen's test, which is done to test the patency of the ulnar and the radial artery. So can you do it like this, sir? Okay, the other side, the other. Okay, so also pain position and assess each leg for size, symmetry, skin color, and temperature for from groin to toes. Note for any presence of lesions, change in skin texture and hair distribution. Inspect the peripheral veins in the legs for the presence or appearance of superficial veins when limbs are dependent and when limbs are extended. So now, sir, proceeding with lower extremities, I will see that color is all over the hair is evenly distributed and your skin is warm. Now palpate for femoral pulse. Okay. I see that the color is consistent all over the hair, is evenly distributed, and your skin is feels warm. And then palpate the femoral pulse. The femoral pulse. Okay, and then there's assess the peripheral leg veins for signs of ulceration, varicosity, and phlebitis. Inspect the calves for ulceration, varicosities, and refresh and swelling over vein sites, and palpate the calves for firmness or retention of the muscle, the presence of edema over the dorsum of the foot, and areas of the localized worm. Push the calves from side to the side. Test for tenderness. Okay, and as I can see that that are no lesions, ulcerations, and edema or swelling or venous pattern or varicosities, and I'm palpating for firmness and tensions. So firmly dorsiflex the client's foot while supporting the entire leg in the extension, and or had the client stand or walk. Then assist the capillary field both. Inform the client assessment was done. If deemed necessary, assess the client to change clothes. Reposition the client comfortably sitting on a chair, and summarize the information obtained during the working phase, and discuss findings. The client discuss to the client possible plans to resolve health and concerns if present. Assess for the client's understanding of the plan and the need to further teaching. Provide the client the opportunity to clarify, ask, or raise any concern, and thank the client to his cooperation, and ended for the assessment politely. Done after care, and document finding is the client record using printed or electronic form. Checklist supplemented by narrative notes. Okay, sir. All the assessment was done, and your cardiovascular system, and just to turn on everything that we've covered. So upon auscultation of your neck, I've heard I have nose swishing or blowing blowing sounds, and pulse are equally strong, which means normal. And then there are no traits, and noted on your jugular venous pressure is at 6 centimeters, and upon assessment of your chest wall of your heart, is the chest movement is symmetrical, no retraction, no have or so pulsation or vibration are palpated in the areas of the apex, left sternal border are based on the heart rate is 75 beats per minute with a regular rhythm. So upon assessment of your upon your lower extremities, arms are bilateral symmetric with minimal vibration in the variation in size and shape. There are no edema, prominent venous offering, and skin is warm. Delivery capillary refill is good, and radial pulse and ulnar pulse, and also your brachial pulse are bilaterally strong. Regular rhythm, which is the very normal. So, and upon performing the Allen's test, the result is good. Upon examining your legs, hair is evenly undistributed and the skin is warm. No signs of edema, no lesions, no swelling, atrophy, and your popliteal pulse, dorsalis, and the posterior pulses are all normal and typically strong. So overall, your cardiovascular system is doing well. So I suggest to maintain a more healthy lifestyle. And so that's all for the assessment. So again, I am your student nurse, and thank you for your cooperation.